How tuberculosis is successfully treated in patients. Tuberculosis is a contagious infection caused by a bacteria called Mycobacterium tuberculosis that is present in the air. If someone inhales this bacteria present in air, then that person has high chance to develop TB in later stage of life. If someone accidentally inhale this bacteria and develop this infection, then here is the treatment given to that patient to treat tuberculosis infection. Usually in most of the cases, this disease is cured by medicines that needs to be taken orally. Patients need to undergo a short medicine course varying from 6 months to a year. The patient is prescribed a combination of 4 strong drugs called isoniazid, rifampicin, pyrazinamide, and ethambutol hydrochloride. It is necessary for the patients to be very serious while undergoing tuberculosis treatment. If the medicines are not taken for a certain period or not taken in a prescribed way as suggested by doctor, then there are high chances for disease to become resistant to the tuberculosis drugs that we call multi-drugs resistant TB. When surgery is needed to treat tuberculosis, involvement of surgery is almost nil when it comes to treatment of tuberculosis. In most of the cases, tuberculosis gets cured just by taking anti-TB drugs orally for minimum period of 6 months. In rare case, like in lymph node tuberculosis, sometimes it becomes necessary to remove the entire infected node. Thus, a surgeon makes a small incision and removes the complete node. Thereafter, the patient needs to complete the prescribed medicine course. Also, in spinal tuberculosis, sometimes surgery is needed. In some patients, the spinal cord bone or disc is completely dissolved by the bacteria. Thus, the infected part needed to be removed and replaced by metal plate. If the spinal cord bone gets twisted to either side and presses any surrounding nerve, then even in that case, surgery is needed to free the nerve-formed spinal cord or disc pressing. An initiative of TB Mukt Bharat Abhiyan. Thank you so much.